The main motivator for us to partner with HSJ was really all about having open access to many of the NHS's top executives. It's very rare to have this many all together in one room, and it's a great barometer of where key issues are right now in the NHS. Our session was about robotics and productivity. What we really wanted people to go away with was a sense of where we are right now in terms of equity of access and also the government ambition for scaling up, and hopefully a way to look to operationalise things.
This is the first time that Consultant Connect has been at an HSJ event. It's a very intimate setting and you get your open and honest conversations. What was Alistair saying this morning? You don't get the diplomatic answer, you get the real answer, and that's really what attracted us to go to something that might be different to what we've been to before. There's so much good stuff happening around the country, but often you don't know about it, and this is good sharing of case studies, networking, also the seniority of it. It's really senior leaders taking that time out, because it's the senior people who are usually the most time pressured and who wouldn't normally take that time out.
The panel was about how the NHS is going to be delivering the National Cancer Plan and how that fits into overall government policy. It was a really good opportunity to have an honest discussion about whether it will actually deliver, what the priorities are and how those go down among the people who have to deliver it. Cancer is complicated and they can't just focus on one thing like cancer waiting times. They really need to keep the overall strategy in mind if we're really going to hit those big ambitious survival targets.
HexRad is about unlocking diagnosis, and that's what we talked about, the problems that are facing radiology departments up and down the country, what we can do to get better clarity and outcomes for patients. Healthcare systems are having to catch up with these increasing demands and more complex care, and for us to really deliver that, we need to redesign systems and have that thought, but also the bravery to make those changes. So I think understanding the problems that matter most and having frank discussions about impact is really important when you're thinking about designing solutions, because those solutions should be for patients and the people who serve them. So understanding those nuances is really important.
The attendance that you get from NHS organisations is always very strong, coupled with the HSJ itself and being part of that wider conversation. There aren't many outlets that provide an independent voice commenting on health service management, and I think management is fundamental to delivering cancer outcomes, so that's why we partner with the HSJ.
Healthcare executives are really busy because they've got really urgent and important problems, so having the space to step away and talk about strategy and how we can collaboratively work together is really important.
It's really about talking openly and honestly about why things work and haven't worked in the past and how we can make sure they work better in future programs. So I like the shift of that.